anytime you have such a powerful drug, you always want to bring it to the early stage. Why wait for the cancer to become metastatic? So here we're going to talk about two other exciting studies, the DESTINY-Breast05 and the DESTINY-Breast11, that are in early stage HER2 positive breast cancer. Talk to me about them.
So yeah, like as you mentioned, like this drug works amazingly in a metastatic setting, but what about using it where we can actually prevent recurrence, cure patients, and try to erase these micrometastatic clones before they get to become metastasis? And so DESTINY-Breast11 is the neoadjuvant trial of T-DXd that has 3 arms. Traditional chemotherapy with anthracyclines times 4 followed by THP, which I have to say I don't love.
I don't love it.
I don't love. I don't usually like anthracyclines in the early setting, but I realize that many groups do still use anthracyclines.
I think the debate that was at San Antonio put the nail into the coffin. TCHP is the way to go.
Right. But the trial needed also an international regime in Europe.
Yes,
Many centers
yes.
use more anthracyclines. And so AC times 4 followed by THP compared to 8 cycles of T-DXd or to T-DXd followed by THP. And the thing I like the most is actually replacing anthracyclines. And so
100%.
either with 8 cycles of T-DXd, but even just with 4 cycles and then THP, if we could do that, it's a great achievement. And then what else? Well, I have to say, DESTINY-Breast05 even more.
Yes.
Because, we're realizing that we can understand what is the risk of recurrence by looking at response at surgery after neoadjuvant treatment. And so DESTINY-Breast05 builds on the foundation of Catherine, comparing adjuvant T-DXd versus T-DM1 among patients with residual disease at surgery after chemo and HER2 blockade. And so I like both trials, but I think DB06 really tackles these high-risk patients that did not achieve complete response, trying to escalate, to erase the clones that may have led to resistance there. And so I expect in some different way both trials to be positive, but I think they may impact let's say, the way we use the drug in different ways. And personally, I really, really like the design of this DESTINY-Breast05. I really look forward having an option to prevent recurrence in this population of patients that have HER2 positive breast cancer that usually is considered treatment sensitive, but it actually is not, because you find residual disease. And so we need to have some powerful drug. We know that T-DM1 improves overall survival in this population, but still there are many patients recurring and dying, about a quarter of them. Can we avoid recurrence in this quarter of patients not being cured? I think we can. I think DB05 will be positive and will show that we can prevent recurrence.
What do you tell people like myself that are worried about the ILD?
First of all, I say thank you for remembering about this important thing, because like everybody should, whenever using T-DXd, should know about ILD and should think about scanning the patients, doing all the 5 S's. So that's fundamental. Then I would say look at DESTINY-Breast3. Look at those curves. Look at what happens when you use a drug like T-DXd compared to T-DM1. And so you can really change the life of this patient if you cure, prevent that recurrence. Hopefully. We still don't have the data, of course.
Yes.
And so I will say definitely scan the patient frequently, like it's done in the trial.
Yes,
Make sure, remember that, because like we cannot, usually the severe ILD that we see are because most of the times you start to have some ILD low grade, even grade 2 with some symptoms, but it's thought to be something else, so you keep going with the drug. We don't want that. We want that whenever the patient has got some cough, has got some shortness of breath, some change in symptoms, and or there is some spot on the CT scan, you always remember ILD. And you always remember that you gotta stop the drug and make sure to exclude or understand if it is ILD, treat it with steroids. So important to be aware of that, important to treat it and diagnose it and treat it early, but also important to remember of DB03, that if you use T-DXd compared to T-DM1 in the right moment, you can change the trajectory of disease.
You can, for sure.